it goes this way.
Now we both sound the same.
I hope so.
I guess like Mike's mean things.
I didn't say I was no professional videographer because I don't know crap about this side of things.
Maybe next video we'll get the mic out of the camera.
Maybe.
Try some new things.
I mean, it was really creative how it slowly,
And intentionally.
yes,
on purpose,
intentionally.
dropped it.
It was artistic. We know what we're doing.
Hey guys, it's Mary,
And Elise.
and we've snuck out the house tonight. Well, I snuck out the house.
Yeah, you're at my house.
Because our husbands are at this Saints game.
Well, we lost. The first game I ever lost being here in the Dome.
Representing.
That's why we are representing today. And the vocals you hear in the background are Bella enjoying a good stare at the ceiling.
Specifically my fan. Because
Yes.
she's a fan person.
She's a fan of the fan. Anyway, so we've come together today to talk about something very important. So when I started charting with NAPRO, Creighton, years ago, I had just had surgery, and that's really the main reason that I did it, because I knew that was important. I was having some pain, possibly infertility in my future, so I thought it was something really that I really needed to do for that reason. I had no idea of all the other health benefits that it could have on someone's life. I didn't know that charting is really for everyone. So that's what we want to talk about today. That charting is for you, no matter who you are behind that screen.
And you, and you,
And you,
and you,
and
and you,
you,
and you, and you, and you.
Yeah, so charting is for everyone, and now I have a baby on my chest. You don't need to know the details. But basically, so why? So first, hormones. Abnormal hormones can affect you on a daily basis in ways that you probably don't even realize. For instance, things like acne, mood changes, depression, things like that you don't even realize can be affected by your cycle, can be helped with NAPRO. Elise has some more information on some things like that.
To talk a little bit, I've got all kinds of lists with me today. Did my research. So to further what she's saying, let me just kind of go into some emotional and behavioral symptoms that you can get. Tension or anxiety, depressed mood, crying spells, mood swings and irritability or anger, appetite changes, nom 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 nom, food cravings, nom 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 nom, trouble falling asleep, insomnia. Oh, I've struggled with insomnia most of my life. Social withdrawal, poor concentration. Physical signs and symptoms, joint or muscle pain, headache, fatigue, weight gain related to fluid retention, abdominal bloating, I don't know why I had to do that one, breast tenderness, acne flare-ups like she said, constipation or diarrhea.
It's true. Just things you don't think of. You would never think of that might be related to something going on with your cycle.
That can be fixed
can
by getting your
possibly
hormones
fixed. And the reason we say
levelized.
that charting is so helpful is because a NAPRO doctor or a practitioner can just simply look at your chart and really get an idea of if your hormones are low or not. And then to be further specific, get your blood drawn and really be able to tell specifically, but really confirm what they already knew just by looking at your chart.
Well, in addition to that, you start to realize, like, because of the training that they give you, you as the patient start to be able to identify things in your cycle. So, like, red flags, I should say, in your cycle. So, especially as, like, we grow older, from the time that we're young to the time that we get older, you don't think that, like, things are going on, and we have friends.
Yeah, friends. Like, so for instance,
We have friends. We do have friends.
got more than just friends. It does happen. So some of our friends, like, as they're getting older, just for an example, maybe struggling with miscarriages or hormone levels dropping and just affecting their mood or how they feel physically during the day. And as we age, like she just said, our hormone levels start to struggle a little bit. If you're charting, you're going to notice changes, or your doctor's going to notice changes right away. You don't have to waste that time, trying to figure. You don't have to wait, for something to really be affecting your life. We all wait till later, till it's like, it's really affecting my life, I can't
Right.
stand it, now I'll go to the doctor. No.
Right.
If you're charting, you're seeing a doctor, they're going to get your hormone levels drawn, they're going to get
Right.
you even right away, so it doesn't have to get to that place.
Right, you don't have to go through any traumas or anything like it. You're already monitoring, so you don't have to, worry about that. So the other thing that we were kind of talking about is the fact that environmental things
Yeah.
can really mess up your hormones.
Hormones.
So environmental factors can really mess up your hormones. And I wanted to kind of talk about just a few of them because it's something that like you don't even necessarily think of. So it's, okay, plastics. This is a list from Hormone Health Network. Plastics, industrial solvents and lubricants, pesticides, fungicides, herbicides.
Really big words.
No, antibacterials, personal care products. And actually, I was talking to my practitioner, like I said, and she said fragrances are huge for this. So us ladies who like to smell good, those are actually affecting our hormones. So use some essential oils instead of, regular fragrances. Yeah. Textiles, clothing, and children's products. Well, that's scary.
And these are a lot of examples. You're not expected to remember all these, and they're not
Right.
going to be a test later.
Or maybe there will be.
These are just examples of like all the things that we don't even realize. Basically, we're coming into
Right.
contact every day, and we don't realize these things can affect our hormones, which in turn, the effects of those change in our hormones can give us those other poor feelings, like the symptoms that we just mentioned.
And why it's so important to continue to chart. And that's why we're telling you all these things, not to scare you and not to be like, the world is a bad place and don't, do anything, don't take one step forward or else your hormones are going to change. Our point being is that from the time that you're young to the time that you're old, you are coming in contact, whether it be stress, environmental, age, whatever it is, your hormones are changing sometimes on a day-to-day basis. So how do we think that it's not important to monitor that on a day-to-day basis? And that's the purpose of charting. The purpose of charting is to have that health care that we keep talking about, that partnership, having that partnership and monitoring it on your own so that when things come up, red flags come up, that you immediately are on them and you don't have to suffer through these long extended things. So
Yeah, so what's the last point is overall to stay healthy, to get healthy, and to stay there. Like, we want to make something very clear. We are not telling you that natural technology is going to fix all your emotional and all of your physical problems. Like, that's clearly silly. That's not the point. But if you're charting, like, why don't you start there? Get your hormone levels, adjusted, make sure everything's okay, and then that might fix your problems, honestly. It might not. Then you need to take it the next step. Go to a doctor and get, the other help that you need. But you just don't have any idea sometimes. And we've talked to a lot of people,
Right.
Where just as simple as change in hormone levels can make a really big impact in your life.
right, and that way, like, you're not taking antidepressants or going through all these other treatments unnecessarily when it in a sense, I mean, it is. It's a simple fix to get those hormones, in balance.
And another thing we didn't mention is that charting, they actually are early detectors for cancer. I mean,
Right,
who would have
that's
ever thought?
huge.
It's a huge deal that they can actually, possibly detect cancer with the charts. And so the way that I kind of look at it as like a chart being kind of like a map, like an aerial view. If you don't have your chart, you just kind of see what's in front of you, if you even see that. But when you have your chart, it's kind of like looking at a parade from a helicopter. You kind of have
That's so
everything
true.
mapped out, especially like we talked about a lot of charts over the years.
Yes.
You can look back and see, well, how was I doing on this day? You can see how things change. It tells a story. I don't know why I
It patterns.
I think of Aladdin, the movie.
Yes, I love Aladdin.
And he's pretending to be the Sultan or whatever. I have no idea why I think of this, but how he sees the parade from upstairs in the palace. He can
Right,
see
right.
like the whole thing happening at once.
Right.
That's what comes to mind.
I mean, like,
You know what I mean?
it makes perfect sense because if you have this historical data, and that's what it ends up becoming, you can see patterns in your life, and then you can look at it from an overview. So if something was to come up, they can look through all of that data. That's what's so cool.
Yeah.
It's not just, to avoid or achieve pregnancy. No, this is medical data specific to you that they can look back and see what's been going on, which is so
And if you
amazing.
are having the issues like infertility, you know, they're
Right.
going to want this history first. And that's why
Right.
the first thing they'll do if you go in for something like infertility is start charting and look at your hormone levels.
Right.
And essentially, when all this stuff is normal and like even where it's supposed to be, those other things fall into place as much as they can or are able to. You know, they don't,
Right.
again, it's not a miracle cure for everyone, but your best
Right.
chances are with everything looking good, including hormone levels.
Right. So just to kind of wrap it up, this is actually kind of what they say for when you start charting, to explain charting. And they say it's a way for a woman to monitor and maintain her own procreative and gynecological health at home. So not just seeing your doctor once, twice, through, you know, or whatever, a year or 3 years apart or 5 years apart, whatever it is, on a day-to-day basis, you are monitoring your health, and it's you doing that. Like, it's putting the power in your hands.
Because you understand it. You know, I used to say this a lot, but for a little while, as I was in like transition and NAPRO doctors, I was still seeing like my mainstream gynecologist and the one in Omaha, so I still needed someone to go get it like a passing her from. And I remember going in with my charts, and I was like, well, wait, why ask him questions or talk about this? Because like I know more about my body than he does. I do. I just do. Like I knew more about my cycle.
Yeah.
I knew more about my hormones. Knew more about my hormones and stuff. And it's just great to just know that stuff, you know.
That's so true, yeah. And then you don't have to worry, you can kind of turn it off. I went into the doctor and asked about infertility, and she wanted to give me the HPV vaccine, and I was like, that's not what I'm here for.
Peace out.
So I was like,
Y'all
peace
need
out,
that.
dog. Yeah. Well, y'all have a fantastic night.
Yes.
We barely made it through this video, just an FYI. This was our first time filming at night, so I think we're both a little tired, which is really funny. So we're glad we made it through.
Yes.
Woo!
That's important to us.
And so Maria will be blogging on this topic the next week, and then after that we're going to have an interview with Lydia Dufresne and her story about why charting is for everyone, because she didn't think necessarily she needed to chart. So stay tuned for that, and subscribe, and
If I knew it in
share.
different languages, I'd say it in different languages.
I know, and share.
Yeah.
So-
Just to spread the word about how this can help so many people.
Russ.
And go Saints!
Woo! Oh wait, are we
Didn't
doing?
get to see my awesome shit.
So thank you.
See you guys
Good
next
night.
time. You're making faces.
Yeah.
Okay, you want my camera?
Can you just
Wait,
talk?
can you see the ground?
No.
Okay.
Can you talk for me?
That's weird. Maybe you should get your eyes checked. Hi. Did you get it? So